Hey everyone, welcome to healthcare reimbursement. This first chapter, we're going to talk about being a health insurance specialist and kind of what that entails. There is a lot of demand in this field, a lot of job openings. They're looking for people that can handle claims processing, that have some coding skills, can appeal insurance claims that are denied or underpaid and win that appeal. And that can also be professional in the workplace. You can look over these questions on your own. You're going to see throughout the PowerPoint, there's going to be a lot of knowledge checks and it'll have the answers and everything. So you can look at that on your own. And for this one, kind of do some thinking about where you want to be career-wise. Okay, before I get started, I know you're probably thinking that this is going to be so boring, and it might be, but a lot of this stuff is good information to know for when you get a job that offers insurance benefits. Because I remember when I graduated from college and got my first job, sitting in the orientation class that talks about all of the different insurance offerings and plans and the things you can choose from, and I had no clue what they were talking about. So this may be some good information for you if you don't already have experience with that. Okay, so after you go to a doctor's office, they will send what's called a health insurance claim to either a third-party payer, which is an insurance company like Blue Cross Blue Shield or Aetna, or to a government program like Medicare or Medicaid. So this health insurance claim is the doctor asking the insurance company to reimburse or pay the doctor for the services that they provided you. A lot of insurance companies require treatment to be pre-approved now, meaning if you or the doctor's office don't get approval before a procedure, they will then not pay for it, the insurance company. And then the patient ends up getting the bill. Okay. Unless your insurance has a hold harmless clause. So this would have to be specified in the contract, but it means that you are not responsible for paying what the insurance company denies. So your doctor can't send the bill to you if you have this clause. Now, not all insurance companies have this, okay, but a lot of them do have what's called a no balance billing clause, meaning the doctor will send in their health insurance claim. The insurance company pays a portion of it, but that remainder that the insurance company does not pay, the doctor cannot bill you for that, okay? This doesn't include co-payments or deductibles. It's just that total after the insurance company pays. Okay, a healthcare provider, as you probably already know, is a physician or can be a nurse practitioner or a PA, physician's assistant. The Centers for Medicare and Medicaid Services, or CMS, is the federal agency in DHHS. So that's the Department of Health and Human Services that regulate Medicare and Medicaid. They put out new regulations all the time for these programs, so new rules and instructions on how to submit health insurance claims to them. So you have to stay on top of all of these updates so you know how to do it properly and your facility is getting, as much reimbursement as they can. Most insurance companies do this also, like send out these updates, which is one reason why there's such a demand for people to do this. It takes a lot of people to stay on top of what's required for this company versus that one. And sometimes your insurance company can change your coverage without you finding out until a few weeks later. So as a health insurance specialist, you can't just bill the same way every time. You have to check to see if there are any changes, not only with how the insurance company wants it done, but if this patient's coverage has changed. Okay, these health insurance claims have to be accurately coded, which is the process of assigning these numeric and alphanumeric codes that say what someone's diagnosis is or what procedure they had done. And this is just to make it more streamlined so that there's kind of this universal language that everyone uses, that, if a patient comes in with high blood pressure, it's going to be this code every time. So just to make it a little bit easier, there are several coding systems that I'm just going to go through briefly right here. ICD-10-CM is for diagnoses or conditions and injuries for someone that is either inpatient, so in a hospital, or on an outpatient basis. Whereas ICD-10-PCS is the procedural coding system. So any procedures you have done on an inpatient basis at the hospital. HCPCS has 2 levels. So level 2 codes are published by CMS, and that's all the procedures and services that aren't included in CPT. Okay, so CPT coding or codes are for procedures or services that are done outpatient, so like at a doctor's office. Okay, and lastly, medical necessity. We'll actually talk about that on the next slide. So this is having to basically justify every procedure or service code that is filed on a claim with a diagnosis code. Okay, so the example, if a doctor is performing an x-ray of someone's knee, there would have to be a diagnosis code showing the patient was experiencing a problem with that knee. Okay, they couldn't have a diagnosis code of shoulder pain, right? Or the insurance company won't pay for it, the x-ray. So that's what medical necessity is. Okay, and again, we won't be going over these slides together, but you need to be looking at these and the answers on your own. So what are some of the career opportunities available? Coders are the ones on the front end. So they're looking at the patient's record, reading through all of the diagnoses, everything that the doctors put on there, looking at what procedures were done, and assigning that to the patient. So this is a very important position because what they do impacts how much money the facility will make in reimbursement. The codes are also used for like research and like data trends and analysis. So if they're not coding properly, it could affect those things as well. Okay, health insurance specialists or reimbursement specialists look at the insurance claims to make sure that that medical necessity we just talked about is there. Okay, so this is from the hospital side. Then a claims examiner is doing that exact same thing, checking for accuracy, looking for medical necessity, except they're working for the insurance company. Okay, so health insurance specialists at the facility or for the facility, claims examiner is working for the insurance company. So they're going to be even more nitpicky, right? Because the insurance company does not want to pay out a penny more than they have to. Okay. A medical assistant does both administrative and clinical duties. They kind of keep the office running smoothly. So they can be answering phones, updating medical records, doing insurance claims, scheduling appointments, arranging for hospital admissions or lab work to be done. The list goes on. They do a lot of stuff. And then health information technicians kind of do all of the above. So they can code, they can process insurance claims, manage the medical records, etc. So these positions aren't just in doctor's offices. You can work for insurance companies or government agencies, hospitals, private billing practices, or even as an educator or a consultant. Okay. Now, what are the training requirements for a health insurance specialist? So most programs will require some general ed classes, some anatomy and physiology, English, etc. Then health information classes, that would be kind of these that you're taking now, like coding and reimbursement, medical terminology, pharmacology, and then some communications and computer classes as well. There's also an internship, typically in the last semester before graduating, where you go into a facility and see how things really work. And this is such a great experience, because you can read the chapter, do all the assignments, and learn all of this, but it's kind of different when you actually get to do it in person. It makes a lot more sense, and it's just a little bit easier to understand it when you're physically doing it. So this is unpaid, of course, but you have to think of it as a really long job interview, because if you do well during this time and show that you are knowledgeable, that you can learn things easily, you're professional, your chances are high that you'll be offered a job there after completing the program. That was my personal experience. I did my internship at Women's Hospital in Baton Rouge, and while I was there, they actually, after a couple weeks, asked if I wanted to do a job interview, and they offered me the job. So really good experience. Take advantage of it. Put in a good impression, because you could reap some benefits from that. Okay. What are some of the job responsibilities of a health insurance specialist? It will depend on what type of practice you work at. Some places will have several specialists, and each of you will be assigned specific insurance companies. So, you would only file claims for Blue Cross and Aetna, and someone else will handle Medicare and Medicaid and so on. But smaller practices where there's just one or two specialists, you would have to know how to do all of them. Okay. No matter where you work, though, you are guided by a scope of practice. This basically just defines the profession, lists all the qualifications and responsibilities, and states any supervision requirements. Okay, so here is an actual scope of practice for a health insurance specialist. I'm not going to read this to y'all word for word, but if you want to pause the video or check out the PowerPoint and Canvas, you should do so. Look into it and see, is this something I want to do? Could I see myself doing this? Okay, you can also be an independent contractor where you're self-employed and you contract your services to different organizations. There are a lot of benefits to doing this. You don't necessarily report to a boss. You can kind of set your own hours and schedule, and choose what facilities you want to work with. One of the downsides is that the organizations that you work at aren't liable for any of your mess ups or mistakes. So you would need to have professional liability insurance to protect yourself. Whereas if you worked directly for an employer, they would be held responsible for any of your mistakes. Okay. This is called respondeat superior, which is Latin and translates to let the master answer. Okay. There is this right to control test, which helps an organization decide if they have correctly classified a worker as an independent contractor. So you can look over this. You will not need to know this information for my class, but if being an independent contractor is something you're interested in, you may want to look over this. All right. These are some of the different types of professional insurance that employers can purchase. And again, this is not something that you're going to need to know from my class, but look over it if you're interested in independent contracting. Okay. Professionalism is defined as the conduct, aims, or qualities that characterize a professional person. Okay. Anywhere you work will have rules of professional behavior that you will be expected to follow. So codes of conduct and policies and procedures. Okay. Employees are expected to develop these skills to show that they can be a professional. And I don't think I need to explain each of these to you, but if you are wanting a more, a thorough definition of each of these, in your ebook in Cengage, it actually goes through all of these, and there's a little paragraph on each one. So feel free to look at that. But a good attitude, self-esteem and etiquette, communication skills, conflict management, being able to take a problem and come to a resolution, customer service, diversity awareness, leadership skills, managing change, productivity, professional ethics, team building, and professional appearance. Okay, like this, I guess. So, telephone skills are also really important when you're working in a healthcare setting. I know a lot of stuff can be done online or in a patient portal now, but there's still a good bit of telephone usage. A lot of people would still prefer to call and speak with someone. So there's usually some sort of telephone policy in place, or a telephone skills training that you have to go through. Especially as a health insurance specialist, you're going to be dealing with these insurance companies probably a good bit over the phone. Okay. As a health insurance specialist, you can join a professional association, and that's what you get credentialed through. Okay, so depending on what credential you're going after, would kind of lost my train of thought. Would determine which association you would want to become a member of. The associations all have like journals and newsletters that they put out, that they're constantly sending out like all the latest updates and things having to do with professional development or continuing education hours. Okay. I'm a member of the American Health Information Management Association, or AHIMA. I have my RHIA credential through them, but they do offer a bunch of others. Here's a couple of the options, and it really depends on which route you want to go with your career. And by that I mean, if you want to work in a hospital, some hospitals may prefer the AHIMA credentials, whereas a physician's office may prefer the AAPC credentials. Okay, so you kind of should think about that before choosing, which route do I want to go. All right, so hopefully you have some understanding of the things listed here. Now you'll be able to go back into Canvas, take your bell ringer questions. If you listened at all, you should have no problem with that. And let me know if you have any questions. Thanks.